This is Pet Life Radio. Let's talk pets.
Good morning. We are live here on Instagram and on Pet Life Radio. Here for you, here for your pets. You know the drill. Here for the next 30 minutes. Ask away anything you want to talk about. You can try. Don't make me talk too much because as you can hear, the voice is gone. I'm trying to stop it from getting to the point. Remember, this years ago, I was doing a piece on Kiss FM with Ryan Seacrest. And of course, of all the days, I had zero voice. And it was so funny because he asked me a couple times. He said, "Jeff, do you want to redo this? We can do this another time." I said, "No, it's okay." So anyway, here to get a hold of me. If you're here on Instagram Live, you're here. Ask away. Here on Pet Life Radio, likewise, you can just ask away. You can call 877-385-8882. Once again, 877-385-8882. And just go ahead and ask away. And the calls will be sent to me. So waving. Now a question coming in already. So let's check that. Hold on. And it is, what is your take on SAT for cancer patients? Well, truth is, I don't know. I've never used it. There are a lot of natural remedies I have found, and again, I don't want to make a blanket statement because I know that it'll bite me in the behind if there was one sort of herbal alternative treatment that actually works. But from my experience, most of these natural, non-drug remedies do not work. I have good friends that are homeopathic vets. They will do a lot of things, and they tell me that they're success stories. I personally, in my practice, when people have tried, it did not work. I always appreciate the naturopaths that also say, when it comes to certain diseases, yeah, you want to get a little more aggressive, you can do some Western medicine as well. But I'm not saying don't do it, and I'm not saying don't do it as an addendum, not necessarily a pure alternative, but if you want to do something to promote the effect of whatever else you're using, I would say go for it. I will tell you one thing, that none of these natural remedies are toxic. So there's no downside. So if your research that you saw says that, yes, it's helpful and you want to try it, by all means, try it. And let me know. Would I treat one of my dog's cancers with just these natural remedies and nothing else? Personally, no. But that's just me. I'm not saying don't do it. If there's enough scientific, I look for the scientific data, peer-reviewed articles. Now look, let's talk about acupuncture. 40 years ago, it was a joke in veterinary medicine. And now it's accepted by almost everybody. We recommend it all the time. So I'm not saying these things aren't helpful. I'm not saying they don't have value, but on something like that, I just don't know enough about it to recommend it. But I will tell you, most likely it's not going to hurt. So I hope that helps a little bit. If you have data, really scientific data, send it my way. Okay, can you talk a little bit about the bully that got stuck in the dog's throat? So those things are. I had a case, actually a neighbor down the street, and it ate a bully stick and chewed off a hunk, and it lodged in the esophagus. We couldn't get it up. When we induced vomiting, nothing helped. Finally, we had to send it to an emergency facility that had a scope. They tried, interestingly, which is what we often do, try to push it into the stomach because it's hard to get the grabbers around the stick or whatever it is, foreign body, without damaging the esophagus. But they could not push it. They felt it was going to tear the esophagus. So they did. They slowly put the grabbers around it, and they were able to get it out. The dog is 100%. I am not a fan of those things because of that. I've heard too many horror stories. So for me, and a lot of times it's people's fault because they might use the wrong size that's appropriate for the dog. But this one was a big one. The dog actually ended up chewing off a hunk, and that's the hunk that got stuck. So, it turned out to be a very expensive bully stick. I would recommend to stay away from these things. If you have dogs that have been using them for years, had never had a problem, and they're chewing well, they know what they're doing, it's okay. But as a blanket rule, if someone were to ask me, what do you think of bully sticks? I know too many stories like this one. I'm not so sure. So anyway, Todd, I hope that helps. Vasectomy versus neuter. Okay, here's the thing. There are two goals here of neutering, all right? And typically, it's not just preventing breeding. If the only goal was to prevent breeding, then a vasectomy could be okay. But there's more to neutering, and the more benefits from behavior, from eliminating the testosterone impulse, that we neuter not just for population control. So then again, why, if you have a dog that's a real good breeding dog, and he is worth a lot of money every time he's used as a stud, then you wouldn't want to do a vasectomy anyway. So if you're going to stop him from breeding, why don't you just do the whole thing? And, you have other problems, prostate issues, behavior issues. This is a statistic I always like to share. And that is, again, if we make some assumptions about how many dogs are spayed and neutered. Well, first of all, a simple one, what percent are male versus female? That's it, 50-50. Come on, 50-50. Now, let's say only 50% were spayed or neutered. So in any one given quarter, that was of a non-neutered male, be 25%. Okay? So if I would tell you, statistically, a dog found dead on a U.S. roller highway, you'd say, well, first some half of them will be male and half female, okay? And then half of each will be spayed or neutered. So a non-spayed female, 25%, a spayed female, 25%, a non-neutered male, 25%, and a neutered male, 25%. Well, guess what? The statistic is that 75% of dogs that are found dead on U.S. roads and highways are non-neutered males. There's a lot more to it than just vasectomy. Because if this dog had a vasectomy, he may not breed with all those dogs he's trying to get to, but that'll be really a waste. If he picked up the scent because he's a male and he's got testosterone, they pick it up, okay, when a female is in heat. And after all that, jumping around out of a fence, going down major thoroughfares, and finally gets to the female, at least he can breed. But if he's vasectomized, he's going to go to all that work and can't breed anyway. Why have him with the risk of all those potential dangers of him running around? So my recommendation is to fix. All right, prednisone. So for prednisone, I like alternate day for a dog, I assume. You want to get as fast as you can to an alternate day schedule. So if you do it too much every day, then you're going to suppress the adrenals, and you can actually end up with a problem called Addison's disease, which is the opposite of Cushing's disease. Cushing's disease is an oversecretion of the adrenal glands. Addison's is where they stop working, undersecretion. Well, if you keep giving steroid on a regular basis daily, the possibility is that you will suppress the adrenal glands enough that they won't be able to work anymore. So I would say, first of all, to understand, there are two dose ranges. You have an anti-inflammatory dose, and you have immunosuppressive dose. Immunosuppressive dose is a much higher dose. It's usually 2 to 3 times higher than the anti-inflammatory dose. For me, anti-inflammatory dose is about a 1/4 milligram per pound. 20-pound dog, 5 milligrams. And I do it twice a day for a few days. Then I go to once a day for a few days, and then every other day. And then if the dog is doing well, and you want to give it a try every 3rd day, then that's good. But the goal is to get them off of every day fairly quickly. Hope that helps. Well, prednisolone is usually used for cats. Prednisone you can use for dogs, and prednisolone can be for dogs as well. But it's the same thing. They're metabolized a bit differently, but prednisolone is converted to prednisone. But for cats, they need the prednisolone to be effective. What age should you start dental cleaning at the vet? And once a year or more? Great question. So if there was a blanket statement, and I hate those, as you know, I would say starting at the age of 3, 75% of dogs and cats over the age of 3 start having periodontal conditions, disease. So I would say then 3. But I've had dogs coming in that are 5 and 6 and don't have a speck of tartar, and their gums look great. It's still individual. I also had dogs that are 2 and already have tartar building up. So I always joke, the dog didn't read the book. He doesn't know what's supposed to happen. It is what it is. So I would tell you, starting at the age of 3, in the general rule would be dogs already start having calculus tartar. So they would need a teeth cleaning. Now, look, if you brushed your dog's teeth on a regular basis, once a year is probably going to be fine. Unfortunately, most of you, and I know who you are not brushing your pet's teeth regularly. So I've had dogs coming in every 6 months. And I love the client that looks at me and says, what do you mean? We have to do a dental? We just did it 6 months ago. I go, wow, it's been 6 months? Really? We should do a little home test, okay? I think I've talked to you about this before, but it drives the point home so well. Not 6 months, not 5, not 4, just 1 month, 4 weeks, easy. 4 weeks, don't brush your teeth at all. Let's see what you look like after a month. So when you hear 6 months, that's a long time, unless you're brushing your teeth with the pet's teeth regularly. So anyway, the only way to really do it well is brushing. You can put water at it, you can do crunchy foods. No. You need to brush the teeth. All right. So what's a good alternative for flea tick heartworm prevention that is topical only and prevents neurological side effects? Well, there really is. The only one topical for flea and tick is going to be Bravecto. And I don't know if they even have one for flea tick and heartworm. So most of the ones are oral. Anything that gets absorbed into the blood through the skin, as those topicals do, or ingestion, if they're going to get a neurologic side effect, they're going to get it. Now, is it overrated? In my opinion, yes. Does it happen, however? Yes. And so I've had very few cases of that reaction it is published. It is real. So, it's hard. It's like Librela. You go online about Librela and it's the worst noob drug ever. Yet I've used it, I don't know, over 100 times. And I've had zero reactions. So, and not only that, clients, not me asking clients to come back for more Librela, they're coming in on their own. Why? Because that stuff worked. So it's a tough call. So I don't know if there is topical flea tick heartworm that may not have any neurologic side effects. Now, one thing I will tell you, as far as the oxazolines go, which are Credelio, Simparica, Bravecto, and NexGard, the dog may have a reaction to one of them, but you can switch to another and they may be fine. And it doesn't cause neurologic disease. It can accentuate if a dog already has or had a seizure or some sort of neurologic dysfunction. If you have the perfectly healthy dog, the most cases where there were seizure behaviors, it was because they already had some predisposition. So again, you got to look at these things carefully, but I use it on my dogs and I've used it on, thousands of patients and we've had no problems. Doesn't mean it doesn't happen, but it does happen because it's published. All right. I hope that helps. Yeah. No bully sticks. I agree. Bethany, hi. Hear my voice? I'm giving good phone. All right. Can dogs have schizophrenia or be bipolar? Oh, you know what? That's a really good question. And I think so, but we don't know how to evaluate it. Now, might term it dementia and, Alzheimer's, the doggy version of Alzheimer's. It can, but there are some dogs that have exhibited some pretty strange behavior. Definitely neurologic, definitely, as we would say, a screw loose somewhere in that brain. Has it been diagnosed officially? I don't think so. That'd be a great question for a neurologist. In fact, I'm going to talk to one of my neuro buddies. I'm very good friends with my neurology professor, and he's now emeritus at Davis. He actually now writes children's books. They're really cute, but he's my go-to guy. I'm going to ask him. And not only that, how can we tell? That's a great question. All right. On that note, we're going to go take a quick break because we have to break here on Pet Life Radio for our commercial breaks. Don't go away. I'm going to stay tuned here with you on Instagram while I mute myself from Pet Life.
You know the expression, cats have 9 lives. Well, what if you can give them one more? The Give Them 10 movement is on a mission to help give cats an extra life. How? With spay and neuter. Spaying or neutering your cat helps them live a longer, healthier life. And it helps control free-roaming cat populations too. Learn more about the benefits of spay and neuter and meet Scooter, the neutered cat, at givethem10.org. That's givethem10.org.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Back here live. I'm going to share this with Pet Life Radio too. So the question was, what do we think about colostrum for a 7-year-old cat with UTI, that's urinary tract infection, with bacteria in the urinary tract? So I've heard of it. I don't know whether it's very effective. I don't know for sure whether this cat is a female, though I assume it probably is because females get much more UTIs than males. And so when I have a persistent UTI in a cat or a dog, the classic antibiotic schedule is for 10 days. I might up it to 14 but if I have one that's persistently coming back, I would first of all make sure 100% that you get a culture. You must have a culture and sensitivity, because if you're just guessing what antibiotic and it keeps coming back, well, that's one of the reasons. It's the wrong antibiotic. So, if I have rods, I'm going to probably use a cephalosporin, maybe doxycycline. I'll give it a shot sometimes. But if I ever get a urine analysis back that has 50 to 100 or greater than 100 bacteria per high power field, I will insist on a culture. Because if you pick the wrong antibiotic, right, that means that those bacteria are still multiplying and multiplying, then you're going to have a really sick cat on your hands or a sick dog. So if it's less than 25 to 50, I might take a guess based on the bacteria or the types. Was it rods? Was it cocci? Was it mixed? And then a lot of times I'm right, and that's good. But I always tell the owner, if this comes back, we are going to do a culture. So culture and sensitivity is very important. All right, Deedles, hello. Also, by the way, cats do better than dogs on, still not, you should just use it with reckless abandon, but they tolerate the steroids a little bit better than dogs. So I would still try to get onto an alternate day or every third day dose, at some point. All right. Hello. Hillary, 10,000 dogs were rescued and not want to react to flea and tick meds. Yeah, thank you. And that's Eloise. And Eloise, because she is a phenomenal rescue, and 10,000 dogs that were rescued, not one had a reaction to the flea and tick meds. And that's what I'm getting. But, it's like anything else. As we know, think of Yelp. All right? How many of you, show of hands, love Yelp? I personally hate it, and I ignore it now. I don't even listen. I don't even care, because it is BS. People that like to complain. Back in the day, before there was all this online stuff, I used to lecture a lot about marketing in the veterinary world, and we talked about the negative reviews. When you piss somebody off, a client off, all right, whatever you did, it didn't work out well, and you didn't handle it well as a veterinarian. I'm talking to veterinarians now. So I say they're going to go home and tell 10 people. But when your clients leave happy, they may tell up to 3 people. And they won't even directly. They're not going to get out the Rolodex and start calling everybody. They're together with the girls, and they're talking, having some coffee or whatever, and the subject of pets comes up, and the one said, I have this great vet, whatever. So my point was, you'd have to make like 3 times more people happy just to equal the one that you pissed off. So now, with all this social media stuff, it's not 10 people, 3 people, it's 10,000 people, it's 1 million people. So it's unbelievable to me. So anyway, I don't worry about it. I don't care. But unfortunately, it has been the literal demise of some veterinarians because of terrible reviews online, on Yelp. And I think, sadly, one of the reasons why veterinarians now have overtaken dentists as far as medical professionals with the highest suicide rates. That blows my mind. And yet it's true. It really is true. So, all right. It's a male dog with bladder inflammation. So, all right. So if it has bladder inflammation, then again, culture first. Make sure the culture is done. Get them on the appropriate antibiotic. Then what you may want to do is use like budesonide or even low-dose prednisone, something to reduce the inflammation. Now, it also could be, very possibly, that the problem with the bladder itself, as you say, inflammation, there may be a bladder cancer in there called transitional cell carcinoma. And that also might be part of the problem. So you might want to have an internist do a thorough ultrasound of the bladder and see if there's anything else going on from an anatomical standpoint that is contributing to this problem with multiple bacterial infections. Okay, high risk, vegetables, mushrooms complex helps too. So all that's good. Protein, cruciferous vegetables, mushroom complex helps. Do you see many dogs that clients want to give meds that you say they're hyper and do you think it's medical or needs training? That's a great question. I think it's both. It really is. I've had some dogs that are just their personality. They're just hyper personalities. And then also many dogs that express their hyperactivity because they are stressed. So it's an anxiety. So when they're anxious, then they start exhibiting this hyper behavior. So in other words, can training help? Can medication help? And the answer is yes to both. It all depends what the underlying cause is. So do I know that people are having a value? I always ask people, are they always hyper like this? When are they not? When do they seem to be more in control? When they are hyper or when they are this anxious, what is changing? What has changed that has stimulated this? How often does it happen? Have you been able to come up with any links to the behavior by external influences? So again, there are many dogs that are just, it's their personality. I mean, it's crazy, hyper anxious. Now, I think, and to your point, I think you're making as a trainer, is that there may be parts of this dog's rearing, or if it was a shelter rescue, that it's prior experience that has made it hyper. And so that maybe if getting into that could be beneficial. Unfortunately, as I often joke, when we have dogs like this, I can't sit them on the couch, right, and start having a conversation with them. When did this happen? What happened in your life? Tell me about your day. I mean, you can't do that. So a lot of times we have to either take the easy road out and give them meds or try training and see if that helps. But what do you think? Is it trainable, you think, without meds? Come back to me. Let me know. All right. Says the system for 3 months is one that you don't want to month. First of all, Sharon, about Bravecto. I shouldn't say I'm not a fan. It's not my fave. How's that? First of all, it only is 8 weeks for the ticks, for most of the ticks. Secondly, even for fleas, clients complain all the time that they're having to use it again. So you're paying for 3 months, and it's more expensive per pill, obviously, because it's 3 months, but you're only getting 2. Well, I don't know that's the best plan. I'd rather get one that works for one, and I'm paying for one. So I am not I don't use Bravecto, let's put it that way. I like Simparica, I like NexGard, I like Credelio, love Credelio for cats. I believe maybe NexGard, one of the others is coming out with its own cat version. So, but having said that, if you are using Bravecto and it is working to your satisfaction, then don't switch. Don't switch. It's good. So I'm just sharing some of my clients' feedbacks. All right. Bruce Brockman. Holy cow. Bruce, that's fantastic. Bruce is a high school classmate of mine. And God, I'm so thrilled. Anyway, Bruce, how you doing? You got to get in touch with me. That's really cool. All right. Nutrition diet for cancer patients, low carb and high protein. Yes, pretty much protein, but also there are some other nutrients. I don't know exactly. We'd have to get a hold of an oncologist to talk about it. But I would say that there are other things that you try to avoid. They even have diets strictly for cancer. The goal is here that whatever we give them, when you have a growing cancer, in essence, it's robbing the bodies of the nutrients because it's using them for itself to grow. So the cancer's growing and you're still losing weight. It's really, really, it's a tough call. So, but I'll try to find out. Thanks. I sound like my grandfather. That's from my sister. So I know he always had a hoarse voice, Beth, come here, Beth. Sound like you're going to be the godfather. So anyway, a lot of hyper dogs I'm training, their owners are not exercise. Oh, well, that's perfect. Yes. Great point. So Vicky makes a great point. And that is that sometimes when you have these hyper dogs, they're not getting enough exercise. So, one of the things we always say, you got to get them out there. You got to get them running around, use up some of that energy because they need it. This is exactly what's going on. So what happens is they get home and you want to get them home and you want them, like what you say, plump tucker tired out. You want to just get them to all they want to do is rest. So sometimes going out, spending a little, half hour extra at the park, throwing the ball, frisbee, a little hike, whatever it is. So when they come home, they don't want to be hyper. They don't want to run around. They just want to relax. Okay. Eloise, so Vicky also seems dogs that as soon as they train, the dogs know what to do. So anxiety is much lower. So some of the anxiety then is that they don't know what to do. So when you get them on a schedule, they learn their schedule, they're more comfortable, then they may not be so hyper and active. Food is mentioned for cancer in dogs, organic grass-fed beef, carbs feed it, protein starves it. That is true. Basically, organic grass-fed beef, okay, carbs feed the cancer, whereas protein starves it. So that's the point. That's why these foods are usually lower in carbs, higher in protein. All right, I hope I got to everybody. I hope I waved to everybody. So those of you that are here for the first time and you want to learn more just in general about your pets, you can ask me anything. It's free. And if I don't get an answer, I will find the answer. So please tell all your friends that if they have pets, start following Worms_DVM. I like to get those followers. And if you're a follower, then you're going to get that alert every Sunday at 9 a.m. in the West and noon in the East to hop on the show. And anything I can help you with, I would like to. And those of you first timers, I hope you enjoyed the show. I love doing it, so that's good. And so, Bruce, I don't know if you saw that Steve Fields is on the show because he's my brother-in-law. So I will yell at him if he doesn't come on. And we've had a number of our classmates come on the show. So anyway, I hope all is well. All right, so next week, same bat time, same bat channel here on Pet Life Radio and Instagram. If you have any questions during the week, you're not going to get a hold of me, Worms_DVM. Most of you probably have my cell phone, so you call me on my cell phone. And here on Pet Life Radio, all the questions that come in are sent to me at drjeff@petliferadio.com. All right, have a good week, everybody. Take care.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.